Hi YouTube, this is Dr. Margolin. We got several questions this week, and actually we were surprised to get a lot of questions about coronavirus and about flu in general. Well, on one hand, our channels usually talks about pain and opioid epidemic. At the same time, our patients, because of other risk factors, age, are susceptible to flu. We see it every year. They're also concerned about coronavirus, whether or not coronavirus will reach our shores, Midwest United States, whether it becomes epidemic or pandemic, as we will discuss. It's still good to discuss risk factors for flu and what you can do to decrease that. We would concentrate again on things we can do to decrease the risk. So let me review what coronavirus is and what we can do. As a background, I want to mention that I'm MD PhD. On my PhD side, I spent some time studying about viruses and molecular biology, epidemiology. So this topic is very close to my heart. Thank you again for this question.
Hi, my name is Tammy Franklin. I am a patient with Dr. Margolin. He gave me my injections for my knees, and since then I was able to do more on my exercise and rehabilitation. I'm actually now on the treadmill for 20 minutes, the bike for 20 minutes. I'm doing 10 sets of squats. It works excellent.
Actually, I had a lot of pain in my neck, my back, my leg, my left arm, and I'm so lucky that I came to Dr. Margolin, and he treated me very well. And since then, he controlling my pain by medicine, and I feel much better than before. Now I'm not suffering, from the pain. Pain is under control, and I'm so happy that I'm coming here, and all the crew here and all the people working with Dr. Marvin, they are very nice and very polite. And
my name's Virginia Bowers. I have been coming to Dr. Margolin's for, about 2016 when I came here. I love this office. I love being Dr. Margolin's patient. They serve me well, and I'm feeling better every time they treat me.
My name is Roger Boyce, and I've been coming to Dr. Margolin, and he's the best that I've seen, and he does me right, and he gets rid of some of this pain that I've got, and I'm continuously coming to him, and I appreciate him, and I thank him.
Hi guys, this is Dr. Margolin. Let's try to understand what coronavirus is first, and then we'll talk about what can we do. Virus is actually not even a cell, it's a piece of genetic material that can intrude your cells, multiply, hijack them, and damage cells. Now, this virus has something that scientists called corona, which means crown, those parts of the virus that help him to invade the cell. That's why it's called coronavirus. As we mentioned, it's also very close to something called SARS, S-A-R-S virus from 2002-2003, which stands for severe acute respiratory syndrome. However, it's somewhat different. Now, I'm not going to speculate what caused the outbreak, whether it's something called zoonosis, means it's a virus that was acquired through animals, from maybe unmonitored improper trade in animal meat in China. I'm not going to go into speculation where it has to do, anything it has to do with the Biological Warfare Institute, which was in that town. I think we'll just concentrate on the facts. The facts is that this virus causes flu, which is very similar to regular flu, with fever, fatigue, nausea, some cough. It develops over 2 weeks usually. That's why they put people in quarantine for 2 weeks. Within 2 weeks, you should supposed to develop these symptoms. And most people just have this flu type of illness. Maybe even more people don't develop any significant illness, and that's why our data on how many people actually infected may be inaccurate, and I'm going to talk about it. But small percent, they estimate 2%, maybe 2 to 3% of people develop shortness of breath, kidney failure, and they die. So far, there are about 565 deaths. Today is February 6th. It changes, but it's fairly small number to the number of people infected, assuming data is accurate. There is between 27,000 to 75,000 based on different estimates infected in China. I think China is doing a huge effort to stop the spread of the viruses with about 35 million people quarantined. They can't travel. And our hearts go to everybody infected, everybody who lost their loved ones, and to physicians who basically have to confront this disease. It's spread to 27 countries. So at this point, the question is, I think we're at the point whether it will become something called epidemic. Epidemic is a spread of the disease in a certain area, or pandemic. Pandemic is just global epidemic in many countries and continents, like Spanish flu after First World War. We still don't know. And if you ask me, based on what I see, I hope that most likely it will not become pandemic, but nobody can say for sure. And I think we'll know better within the next couple of months. Now, the question that people ask, and that's why we're making this video, what we can do, what any of us can do to stay safe and protect ourselves and our loved one. And we will address this question in the second part of this video. Thank you again for supporting our channel and asking the questions and participating. Thank you. Okay, the second part of this video, we're going to talk on what can we do. Now, it depends on how concerned you are. There are just a couple of cases in the United States. At the same time, the spread of the disease is very significant. Again, if the data is accurate, it started with just like 200-300 cases a month ago, and there were between 22,000 to 75,000 cases infected, mostly in China, some in Hong Kong. So if you're not concerned, I think travel with a mask, because you're concerned when you travel through international airport. You're concerned that some people who travel through China and other affected areas are not detected. And also when you travel in a closed area like Greyhound bus or plane, most commonly, everybody breathes the same air for some time. So if you put a mask, you somewhat decrease your chances being infected. However, if you're really concerned about it, maybe you should cancel non-urgent travel of the next 2 months. That's the first matter. Obviously, you want to maintain good personal hygiene. You need to wash your hands. Just simple washing of your hands with a soap and water. That's the best thing, primarily in the medical offices. If you come to medical office and you're concerned about the flu in general and this type of flu in particular, you want to put a mask. People will understand it. There's really no downside in that. Now, beyond that, what else you can do? Vaccination. Now, many people would say, why won't I get a flu vaccine? Generally, it's a great idea. There is no flu vaccine for coronavirus. But again, most of the chances that for you to get regular flu than coronavirus, at least in our area, Midwest United States, and generally in the United States, generally, most of the time, it's a good idea. Flu vaccine does not protect you from all types of flu viruses, but it's still a good idea. Secondly, people above age 60, which is the highest risk group, and that's one of the reasons we do this video, because a lot of patients in pain are actually older patients. and the highest mortality are among the patients with complications who are above that age. It's better to get pneumonia vaccination. And if you're going to do vaccination, I also strongly recommend zoster vaccination. I've seen as pain management many people with zoster pain. It's excruciating. You want to get this vaccine. The new vaccine I think is very good and efficacious. So I would advocate getting this flu vaccine: flu, pneumonia, and zoster. Again, remember, none of them actually can protect you from coronavirus, but all three is a good idea for the reasons I explained. Now, there is no antibiotic, obviously it's a virus, and no medication created yet for coronavirus. So the best thing you can do is to boost your immune system. And that is a good idea generally at any time during this period of the year. And how you do it? First, garlic. Again, there are different opinions. I don't see any downside in taking garlic supplements. This is garlic bulb supplement, which from Nature Way, again, we are not recommending a specific company, but just the one we have. It says certified authentic or any other standardized capsule. It has about 580 milligrams per serving. You can take 1 to 3 capsules daily, and it does not produce any smell or odor. If this is your concern, capsules, nobody would know that you take it. Another option is something called aged garlic extract, which some doctors recommend over regular garlic. It's also more or less the same dose, 600 milligrams. Take 1 capsule with a meal twice a day. If you eat a lot of regular fresh garlic, it's great, but obviously you need to deal with smell and you need to eat sufficient amount. Now remember, usually you would need to do it on a daily basis. It's like you want to build your military before the war, you want to boost your immune system before the flu season. There is some rationale to take it during the flu season, but I would say it's less efficacious. You want to do it on a daily basis. Another supplement that many people recommend for the same reason is called oregano oil. Oregano oil provides you immune boost. You can, again, we use this company. You can actually see the oil inside the capsule, and you take 1 capsule daily. Again, you preferably take it before flu season. Other ideas, elderberry and echinacea. You basically, we recommend you take them as a tea. You take them as a tea. We like paca. This is organic tea. You take them as tea bag. You can get them on Amazon or again in your local supermarket. We like because it combines elderberry and echinacea in 1 bag. We actually recommend making an extract from the bag, like in a small cup, pour it with hot water, and then you can drink multiple tea cups from that extract a day, adding hot water to the extract. We also recommend wild tea number 6. It also contains elderberry and some other red currant, cranberry, hibiscus. So it's mostly marketed as antioxidant, but it definitely has immune system boost properties. Now those two, you can actually do. They're more pricey. You can do during flu outbreak, whether it's regular flu, whether you're concerned for coronavirus, or whether it's pneumonia. Obviously, you need other medications for pneumonia, like antibiotics, but I assume it's bacterial pneumonia, or additional medical attention. But this you can take during the outbreak. Oregano oil and garlic, we think you would be better off taking all year round. And the last but not least, and people forget about it, increased stress decrease your immune system, weakens your immune system. And we generally recommend working on stress reduction. In the description of this video, we put a free link to 8 guided meditations, which is I think 9 to 10 minutes or less. And you can, mindful meditations, you can do them daily. Any time of the day, just do them regularly. First week you do track 1, second week you do track 2, and so on. Third week track 3 up to 8 weeks, and then you repeat or do 2 you like the most. And again, if you do it consistently, it reduces your stress, boosts your immune system, and hopefully with that, we all stay healthy during this challenging flu season. Thank you again for your questions, and thank you for participating in our program.